All right, and we are live. Let me make sure because I'm looking at our camera here, and I want to see us moving and talking. There you go. There you go. This has worked, and it's so good to have you here. Let me give a quick introduction and welcome our audience so that we can get right into this super interesting topic today. If for everyone that is watching us live or that is watching this replay, I wish you are having a phenomenal week. My name is Ana Osuna, and I have the pleasure to be one of the two owners of Puffy Organics. And I am particularly passionate about the subject we're going to be addressing today. As you know, we have completed our series on self-love that we initiated in the month of February. And in the month of March, it's the celebration of the World Oral Health Day. And in preparation to that, amongst other subjects, yes, it is Women's Day, International Women's Day
Women's
on the
Month,
8th of
yeah.
Health. Yes. And we are going to be creating some additional content for that as well. But in preparation to the World Oral Health Day, we want to bring to you some education that I think you're going to find very enlightening. I've had a lot of aha moments as a result of a conversation, our dear friend, Leanne Montoni. So let me tell you a little bit about Leanne. Leanne is a dental hygienist, and she has also been a puppy guide for the last almost 9 years. I'm going to say it's 1 month to go to be 9 years, Leanne. And tell us a little bit. I think our audience will want to know, why did you choose to get related to Poofy initially, and then how has Poofy integrated into your lifestyle briefly, and then we're gonna talk a lot about teeth and gums and saliva and you name it. I think it's going to be very, very interesting.
All my favorite things. Yeah, so I've been a guide now for, like you said, about nine years. I've been a dental hygienist for like 23, I think, and then in the dentistry field a few years before that. So I just got involved with Poofy as I was starting to learn and grow and trying to understand how our products that we're using on a daily basis, how they were affecting me and my family, because my daughter and I, we were kind of having some skin issues. And that's kind of how we tumbled down this hole of information on, wow, there's all these different ingredients that you're going to find in your personal care products, and they're going to get on your skin and they're going to be absorbed through your skin. And some of them can affect your skin or your insides, And so once that started 9 years ago, then I just never stopped. And that just continued to progress. And then I started to learn about holistic hygiene and more natural ways to just support our oral health. And so I kind of like merged the two over the past 9 years. And so that's what I focus on now.
So talking about the way you started with Poofy because of skin issues, right? And I think as someone that has suffered from eczema myself, finding the right products that can hydrate, moisturize, and nourish my skin without being too harsh on my skin was like a game changer, right? On a
Right.
personal level. Now, that led me to research and understand more about the absorption of toxins through your skin, right? And what you put into your skin ends up in your bloodstream and then going through every organ in your body. Let's talk a little bit about toxin absorption through our mucose.
Yeah. So your skin is your largest organ, and it's your biggest like barrier, and almost it definitely plays a big role as far as like helping your body detoxify too, because it wants to kind of prevent thing. It's like it's your barrier. And so yeah, your oral mucosa, I mean, that's skin too. I think it's still not treated as a whole body sometimes, right? We've got the medical field and we've got the dental field, but they are related. And your oral cavity is full of this really soft, permeable tissue that is not going to be like some other areas of your skin on the outside of your body. And it's going to absorb things too, and it's going to get in your bloodstream, and your body's going to have to either absorb it and utilize it. It's going to recognize it, it's going to utilize it, it's going to help your body, or it's going to be something that your body can't really recognize, can't utilize, and now it's got to detoxify from it. So most of those are going to be those outside toxins that aren't really necessary in your personal care products.
That's that. I think that's super interesting because we consumers in general, right? We
Mm-hmm.
as consumers tend to believe, or most consumers tend to believe what we are fed through different media outlets, in typically as a result of advertisement, right?
Mm-hmm.
And it's not super common that some people will try to dig further.
Right.
And on that note, because our subject for today is myth versus reality, I wanted to share with us what are some of those myths that we tend to believe in, probably because they have been passed down through generations in our families, or a dentist told some once to my great grandmother, and now I keep practicing the same habit, not knowing that it might be not necessarily grounded in reality.
Yeah. Yeah, I mean, I think a lot of that just boils down to you just need to brush and floss and use fluoride and you're good. Like watch your sugar intake. Um, and it's really not that simple. If when I'm seeing a patient or if I'm helping a friend or a client who come to me and say, "Oh, my mouth, this is what's going on," I'm thinking about all sorts of things like if they have redness, do they have inflammation, do they have sensitivity, is there bleeding, um, is their mouth dry? And then based on what those answers are, well, then I think, okay, well, could this be side effects from a medication? Could it be something you're exposed to, right? So your ingredients in what are you putting in your mouth? There's ingredients that can cause all of those different things. So to have a healthy mouth and a healthy body, it's really not as simple as just grab some fluoride toothpaste and brush your teeth. It's just really not that simple. It's not difficult to have a healthy mouth. It's just finding what is proper for you and your body and your routine and specializing it to yourself. It's easy to do, but it's not really
You
as
know,
simple as.
I am making notes here, Leanne, and I'm listening to you. And this is going to be interesting because, like, we've talked before about this, but I have the feeling, how there are some great books, and when you reread them, you find new information that gives you a new aha. I'm
Yes.
listening to you saying things such as, I'm looking for other symptoms, such as inflammation, bleeding, sensitivity, etc. And I'm going to put a pin on fluoride because I think that's a conversation that our audience is going to enjoy understanding.
Mm-hmm.
A little bit of what you explained to me on natural fluoride and the fluoride that we're being fed right now, and the difference between both. But when I heard you say inflammation and bleeding, and it could be a reaction on the products that you're using, it took me back more than 2 years ago that I used to have chronic inflammation. And until now, I realized that I almost bled. And
Yeah.
I have not had bleeding in the last 2 years since I switched my products.
Right.
And chick. And now that you're saying you're putting ingredients that are causing a reaction, I'm like, no
Yeah.
wonder, right?
Yeah. And that's the progression. You get the inflammation. Well, your body's sending the red blood cells there to help clean things up. And so you get the inflammation. And then if you don't make the changes, then yeah, you eventually you get the bleeding. Your body is trying to fix itself. So
So
you
what
really,
are, tell me, because you said you make the changes. What are some of the changes that you recommend your patients when you get this trigger or buzzwords? Or
okay, so I am a huge fan of keeping a journal. Like a week or two, keep a journal. What are you eating? What are you drinking? What kind of products are you using in your mouth? And what medications are you taking? Sometimes that's all you need to see a pattern. So I am a huge fan of doing like a food log, food journal, whatever you want to call it. So I tell a lot of people to do that initially. And then really what you're looking for is how's the diet? Are you getting a whole food diet in so that you're ingesting those vitamins and minerals and everything? What's your acidity like throughout the day? You know, what are you drinking? What are you eating? Are you getting enough water? So is your pH just too acidic? Because that's really the environment you want to avoid is an acidic environment. Yes, sugar plays a role in oral health. The bacteria lives in your mouth. They're supposed to be there. We just want more good bacteria than bad bacteria. And we don't want to provide it too much food. Um, and they love sugar and carbs. But it's the acidic environment that they can really, utilize. And then, is your mouth dry? Um, that plays a big role in it too. So that could be medications. That could be, are you breathing through your mouth instead of your nose? Are you hydrated? And I'm not talking just about water. I'm talking about, are you having really hydrating fruits? Yes, are you drinking water? But you could be low on some essential electrolytes that really truly does keep you hydrated, and that's going to affect your mouth too. So I'm looking at all of that stuff. Or are you exposing yourself to too much alcohol in your mouth, which is extremely drying as well? So for some people, that could be a drink. For other people, that could be a mouthwash that is too drying, or again, a toothpaste or something that has there's several ingredients that can irritate people's tissue and cause dryness or cause irritations.
give me, give me, give me, you're so good. You give me a couple of ingredients that are abrasive for mouth, teeth in general.
Yeah, so there are two big ones that I notice with my patients that really affect them. There's sodium lauryl sulfate, so SLS is what that's shortened to. And that's going to be your ingredient that causes all the foaming. It's a foaming agent. So when people brush their teeth, many people believe like I need it to be bubbly to doing something. And that's not really the case. You don't need that. But SLS is really irritating to a lot of people's tissue. It can cause sloughing. So it kind of, your tissue smears away. Once you quit using it, your tissue heals and it's fine. So that's really irritating. And then the other one can be triclosan. Um, that is like an antibacterial type ingredient, antimicrobial. And really what it does is it just kills everything. And that's not the goal. We want to create a really healthy environment in our mouth, a healthy microbiome where we have plenty of good bacteria and not so much bad bacteria. And so that triclosan just kind of knocks out everything, and that's not so great either.
All right. So, in your experience treating patients that have had some of these conditions, and assume that I am one of your patients, even though we live far away. So, for so many years, I suffer inflammation and bleeding and gum disease, right?
Mhm.
And for some reason, I believe that this is the way it's going to be until the day I die. And my nightmares were that I was going to lose my teeth one day.
Yeah.
And 2 years ago, I started using our Happy Teeth toothpaste and included the mouthwash.
Mhm.
And to my surprise, because I truly never expected this result, and I'm not saying that it's going to work exactly the same way with other people, but I can only speak for personal experience, right? We're not trying to say that it's going to cure or prevent any kind of condition or disease. In my experience, to my surprise, and to the surprise of my dentist, the inflammation decreased dramatically. I used to have pockets of fours and fives, maybe even some six, especially in the back tooth. And now it's almost all of them are three, and then the worst ones are four because the inflammation has decreased so much. And now, of course, now hearing you talked about this makes perfect sense. If you remove the agent that it's creating the inflammation, right?
Yeah.
Just by swapping the products, you're helping your body heal itself, right?
Mm-hmm.
Basically.
Mm-hmm.
In your experience, for the patients that you have recommended transitions or even just removing other things, like stop using the yellow mouthwash, for example, that it's super strong. Let's just put a pause on
Yes.
that. Results that you have seen.
Yeah, so that is my first go-to is let's just omit some things first and try and get it down as just as simple as possible. We start there. But then if you can replace it then with some really gentle natural ingredients like baking soda, coconut oils, um, aloe, like all these natural ingredients that are actually they can be natural antibacterial, but not to the point where they're killing all of the bacteria. They can be natural moisturizers. They can decrease inflammation, soothe irritated tissue. So there's really natural ingredients that you can have that. So I'm not surprised that you experience that when switching over to a cleaner toothpaste and mouthwash. You've removed the irritants and then you introduced some simple ingredients to help the tissue start to improve.
Let
So
me
that's,
ask you
I
this
definitely
question.
see that in my patients.
Be brutally honest. Which ones, if any, of the Poofy products for oral care do you use on a regular basis?
So I'm a huge fan of the mint toothpaste, like
We
huge
have it
fan.
too.
And I used to have a lot of sensitivity. Um, And so I used to use an over-the-counter sensitive toothpaste to help out with that. But when I switched over to Poofies, my sensitivity completely went away. And that didn't happen with the, name brand paste that I was common to me in all those years that I was practicing. So that's what I experienced. And I was just sold from there. So I don't experience any sensitivity anymore because of that. Um, I like to use toothpaste in the morning. I like to use a tooth powder at night. I don't know why. It's just what I started doing and I like it. I am a huge fan of oil pulling. Have you ever oil pulled?
Okay. Okay.
I'm a huge fan of oil pulling. I see in my patients who have systemic issues like autoimmune type disorders can really present in your oral cavity, and the tissue can really be irritated and tender and uncomfortable. And so I like to recommend oil pulling, and I love our mouth.
Drop. Oh, the
Yes, the gum.
mouthwash or the gumdrops?
No, the gum drops.
The
So our
gumdrops.
essential oil blend, I love recommending that. And you can add that to some coconut oil before you start swishing it in your mouth. So I love our gum drops. And then I like the mouthwash too. I never use Listerine either. I've just never been a mouthwash person. So I'll use it on occasion, but mostly I use the toothpaste.
Okay. So the toothpaste is a no-brainer. It's an easy solution, right? Like you just use it as a regular toothpaste. It has
Yes.
a different texture and it has
Mm-hmm.
a different taste. And over time, if you're like me, you end up loving it to the point that then it's hard to use any other toothpaste because
It really is.
it's super
You,
refreshing.
yeah.
Now, give us some tips on how to use the tooth powder.
Well, you can really just, and you have to be comfortable. I have some hygienists who are like, I can't do that, but I just get my toothpaste or my toothbrush wet, damp. So you can put like, dump a little bit in the lid and you get your toothbrush damp and then just dab it in the powder right out of the lid. Or sometimes I just do it in the container, but you know, but
I
you don't want
that
to do that when you're sick, just like you need to
yeah,
replace your toothbrush when you're ill.
yeah.
You
Or
you
if you
don't
share
want
the jar
to.
with someone, another member of your family, you probably don't want to share. Every person,
Exactly.
but I do it on the lid personally,
Yeah.
but I don't mix it with anything else. Leanne,
Oh
is
no,
that
me
is that
either.
okay? I just go
Correct.
straight
Just go straight in the mouth.
in the flavor. It's
Mm-hmm.
incredible.
Mm-hmm.
It's a very different experience than the toothpaste.
It really is. And so I think for someone who is transitioning from regular over-the-counter toothpaste that is super sweet and super bubbly, you're not going to want to switch right to the powder. It is so dramatically different. And I think most people feel like it's not doing a good job. So the poofy toothpaste is just perfection when switching over from traditional paste to an organic, clean toothpaste because it has a very similar texture to your
Yeah,
typical
true,
toothpaste.
true.
Um, it's not super foamy, but it's also not. I've used other ones where I feel, I don't know, like it's too watery or something. I don't know how
Okay,
to describe it, but to me, it's a really great transition from
the
over the counter
texture.
toothpaste to something clean and organic, and it still feels like toothpaste
Let's
because
talk.
nothing's going to work if if it's not user friendly. You know what I mean? Doesn't
True,
matter how good it is.
true, true,
If it's not user friendly, it's
true,
not going to work.
true, true. I I keep thinking that it sometimes is a matter of trying one more time. Like back in the day, I used to have a BlackBerry before having the iPhone. If you remember the BlackBerries,
I
those have
remember
like
I
the,
never had
the,
one.
the keyboard right in. And when my husband said, "Oh no, we're gonna get iPhones," I thought like I can't do without my keyboard, right? And it was
Yeah.
super counterintuitive at the beginning to just like with the touch and the feeling, and now I mean,
And now
it's
you've
like second
adapted.
nature.
Exactly. But you're right.
No,
Try something. What do we tell our kids too, right? When they're little, okay, try this veggie. Okay, thanks for trying it. If you don't love it, fine, we'll bring it back later. So you can do
yeah,
that when you're experimenting with cleaner products.
yeah.
Try something. If you're like, ah, I don't know, give it
You
a
don't
give
give
it
up
a
on the
couple
first
more times.
attempt.
Yeah.
So let's go to fluoride.
Okay. Hot
So
topic.
fluoride is the miracle ingredient that is going to help me have healthy teeth forever.
Right.
Unless you're someone like me who used fluoride for 30
Right.
something years, 35 years, and still had cavities in her teeth. Why?
Yeah. Fluoride is beneficial. It can help remineralize. Um, but it is a neurotoxin. So, it is not necessary. When you have something that might work or does work, but maybe has unintended consequences, it is not something that you need to use, especially when there's something cleaner that is just as effective,
Alternative. Okay.
right? So eh, I'm going to simplify this I'm going to simplify this really down small here. I've been out of school, like I said, almost 25 years. If I remember the story correctly, it was a small town, and I want to say in Colorado, but don't hold me to that. It was a small town. They realized there wasn't a lot of decay. And what did they have that was different? Well, they had naturally occurring fluoride in their water system. Great. So that's how it was realized that fluoride could be effective. The problem now is we're not exposed to naturally occurring fluoride when we drink our water. We're just exposed to a chemical byproduct like fluoride that's put in the water. But the thing is, I still see patients all the time who have decay. So it is not this miracle ingredient that, here, just use more fluoride, just brush harder and use more fluoride. It doesn't work that way. Like I said at the beginning, it's really about what's your microbiome like? What's your immune system like? And how dry is your mouth? And what are you eating? And because you have side effects from medications or things like that. And it really is such a bigger thing if you're trying to have a really healthy body and mouth. It's not as simple as just use this fluoride and you'll never get a cavity, because that's not the case.
We have a question from Cheryl Nettler asking, please
Oh,
explain oil pulling.
please explain what?
Oil pulling.
Oh, oil pulling. Okay. So it's an ancient Ayurvedic practice where you take typically coconut oil, or you can use a high-end olive oil, organic, of either. So if you're using coconut oil is the popular one, you take about a tablespoon and you scoop some organic coconut oil out, and it's going to be the solidified, right? It's what comes in a jar. And you put it in your mouth and you start to swish. Now, you're supposed to swish it around in your mouth for about 15 to 20 minutes. But if you've never done it before, you're not going to last that long. You kind of have to work your way up to the 15-minute mark, I find, and keep yourself busy. I usually walk around and maybe I'll check my emails or feed the dog, whatever. I'm doing something while I'm swishing. But coconut oil is very moisturizing. It calms irritated tissue. It soothes it. It does help pull impurities, so toxins. It helps detoxify the mouth, pulls impurities out. It is a natural antibacterial and antiviral, so it will help kill bad bacteria, but support a healthy microbiome so you still have good bacteria. You can do it several times a week. It's just so simple, but so effective. So yeah, it's really that easy. And then you just want to make sure that when you spit it out, you spit it into your trash. You do not want to spit it into your sink because it will harden back up in your pipes. So yeah, about a
That's important.
tablespoon, start small, work your way up to 15 minutes, and then spit it in your trash.
If I want to add the gum drops for someone like me that has gum disease,
Mhm.
how many drops should I add to that teaspoon?
Oh, I don't know, 3 to 5 maybe. Yeah. Or to taste, if you don't want to taste plain coconut oil, that's why sometimes I like to use olive oil. If you don't want to taste plain coconut oil just because it seems weird. Some people have a texture issue because you are starting with more of a solid and you have to work your way till it liquefies in your mouth, which is why olive oil is nice. But you could just do it to taste because it's got those wonderful essential oils in it, peppermint and is there clove in that one? I can't remember offhand.
So yeah, so it
Yeah,
helps also
peppermint, cinnamon, tea tree, clove, like all of those.
with antibacterial properties and
Yes.
anti-inflammatory properties as well.
Yeah. It just takes something so simple and like up levels it with those essential oils in there.
So I know some of our customers like also to mix coconut oil with the tooth powder.
Powder.
So that's another way to brush with tooth powder and coconut oil.
Yeah, absolutely.
And
I've just
it's
never done it.
I I'll say probably the more time you have and the less kids you have, the more you can experiment with them. I go straight.
Exactly. Like just give me a tube of toothpaste.
um, okay, so we talked about fluoride, we talked about oil pulling, we talked about gumdrops, and what are some recommendations now that we've talked? So one of the myths you said is sugar intake. What's your sugar intake? Um, the other one was use more fluoride and then brush constantly and floss. And I think we've learned the products that you choose to brush are important. Your mouthwash is important because if you are experiencing sensitivity or bleeding or inflammation, you may want to look into the products and plus, and how's your diet and how's your
Right.
hydration.
Right. But that would be the first thing. If someone is experiencing bleeding, inflammation, sensitivity, redness, weird white stuff smearing off their lips, the first thing I recommend is we need to change you to something simple
Leanne,
because there is an ingredient that your mouth does not like. Like that's the first thing. And then, yeah, you're going to want to go to what's your lifestyle like? What are your eating habits? Breathing is, I feel like it's really being talked about so much more these days. It wasn't 25 years ago when I graduated, but it is so important to have good nasal hygiene as well as oral hygiene. And one of the best things you can do for yourself is breathe through your nose all the time, unless you're talking. You shouldn't be breathing through your mouth. So for many people who are cavity prone, they might just have more cavity causing bacteria. So we
mhm.
need to decrease that, sure. But then we need to make sure the mouth is a healthy mouth. So we want to make sure they're not mouth breathing so that your mouth is not too dry all the time. And we want to make sure it's not too acidic and all that. So the breathing thing is just, it's huge right now.
Leanne, have you had any patients that has something done? I'm going to say the way it translates from Spanish to English, so it might not be the right name, but their tongue looks like a map.
Oh, yeah. Geographic tongue. Yeah.
Uh-huh.
Yeah.
So I have going back to those symptoms that you're mentioning. I used to have I that's another symptom I used to have, like lines in my tongue of inflammation. It
Yes.
wasn't it didn't hurt
Right.
really, you know,
Yeah.
but it had a little bit of a different color and like
Hmm.
borders,
Hmm.
and that's also gone. Is Could that also be an allergic part of that allergic reaction?
Yeah. So you definitely can experience, some people have geographic tongue and some people don't at all. But the people who do have geographic tongue, and geographic is like you described, it's called geographic because the
The pattern,
discoloration, yeah, the
it's
pattern will change. So wherever you have redness and discoloration one day, it will move and be something different the next day. So that's why it's called geographic. But it can be really irritated by spicy foods, by ingredients like SLS, things like that. So I'm not surprised that you saw a decrease in the redness and inflammation, even though it wasn't necessarily painful for you. I'm not surprised that changing out and pulling out those toxins and irritants from your daily use resulted in a healthier tongue.
there's an ingredient that I've heard about for remineralization of your teeth, that it's not fluoride. It's called hydro.
Hydroxyapatite. Yep.
Yes.
Yes.
So any thoughts on that one? Say it
Yeah.
again.
So
Hydroxyapatite.
hydroxyapatite. Yes.
Hapatate. Okay.
Yes. That is a natural form of calcium. And so it works well in remineralizing the enamel because your body can recognize it and it's bioavailable. So it can be taken up by the teeth and utilized to help remineralize the enamel. Yeah. Yeah, it's a great ingredient.
All right. So I'm just going to say stay tuned for more on that regarding that ingredient.
Well, that's good.
Um, okay. So general recommendations. I want to make sure that I can recap what we've been talking. We said from the beginning, watch your sugar intake, brush consistently, floss consistently, and fluoride are not just a magical recipe for oral care, right? You have to look into other things, such as diet. In diet, you mentioned having good level of hydration, which, by the way, we have a product that we don't talk about much, which is our electrolytes that you
Mhm.
can add to any type of beverage and pretty much make it an electrolyte or a
Every day.
replenishment drink. And
Every
it can
day.
be added to water, to juice. I mean, you name it,
Yes.
to a smoothie, to anything.
Yes.
And so hydration, but you also said fruits and fruits that contain water, right?
Hmm.
Also,
Hmm.
and we know berries for antioxidant properties.
Exactly. Antioxidant, anti-inflammatory. I mean, berries are wonderful for that.
We talked about alcohol intake, whether it is uh, at the bar, in your kitchen, or through your mouthwash.
Yes.
Watch it because alcohol can be an irritant and really hurt your tissues. And those two ingredients to avoid, the triclosan and the SLS.
Mhm.
Um, Breathing and what I want to make sure is that we're covering all the bases so that we can bring hope to people that, like
Yeah.
me, were probably defeated by a history of having bad oral health, and
Hmm.
always feeling on one side kind of guilty, like what is it that I'm doing wrong, right?
Hmm.
And on the other side, kind of like just take it as it is because it will never change,
Right.
like
Right.
defeated in the sense that it won't have a solution. Now, you
Right.
said something earlier today that I wanted to share with everybody, and it's
Okay.
super interesting. It's
Okay.
about spitting out
Oh, yeah.
or not,
Yes.
or when, or
Yes.
rinsing. So tell us a little bit about that and why and how. And goodness gracious, let's try to find that middle ground.
Yes. So this holds true whether you're using over-the-counter toothpaste or you're gonna, go ahead and try Poofy's organic toothpaste. Um, you don't want to brush your teeth and then immediately rinse your mouth out. And I don't know when that started. I don't know why we all do that, but we brush and we immediately rinse our mouth out. And what we've done is we've taken whatever ingredients were in our toothpaste and we've just spit them down the drain. And they're no longer in your mouth to chemically bind with your enamel and help remineralize it, whether that be fluoride or whether that be hydroxyapatite or whether you use xylitol or whatever. You just rinsed it all away. So you can see a really great improvement. I've seen it in my patients. If you brush, you spit, and you do not rinse out. At least wait 20 minutes before you eat, drink, or rinse. You want to give it time for the ingredients to chemically bind with the enamel and help remineralize it before you get rid of it. Otherwise, it's doing nothing. Because you can successfully remove plaque and bacteria and massage the tissue with just a wet toothbrush. You're chemically or mechanically removing,
Mechanically.
yeah, you're mechanically removing the plaque and bacteria, massaging your tissue. That is extremely good. Um, but when you introduce something like toothpaste or tooth powder, you're doing it on purpose, right? We're doing it to help remineralize the teeth in a quicker manner than what we would just do naturally. Our saliva is going to remineralize our teeth over time, but there's a reason we choose to add toothpaste to it. And it's to get some of these ingredients in there. And so the last thing you want to do is rinse your mouth out. There aren't those ingredients.
I
But
am tempted to tell people that are not using natural or organic toothpaste. I'm
to rinse
tempted
it
to
out.
tell them, please rinse out. You
But
know
please
what?
rinse it out. Yes. Yes. So, right. There's two thoughts on that. If you're still using over the counter toothpaste with ingredients that are irritating, yes, rinse it out right away. Get it out of your mouth, right? It's irritating your mouth. But the goal is to really quit using that. Try an organic, clean toothpaste with ingredients that support a healthy microbiome, support your tissue, support your teeth. And those are the ingredients you want to keep around, right? And if it seems weird to you, which a lot of people, if they've never done this, it does feel weird, go ahead, do your routine, brush, spit, rinse, do what you want to do. And then just at the very end, go back in with just a tatty bit more toothpaste. You don't need to brush for another 2 minutes, but at least you're reintroducing,
Those good
those
ingredients.
ingredients back to the teeth for remineralization. Yeah.
Leanne, it has been a joy and a delight to have you sharing your knowledge, your wisdom, and even your cuteness with
Oh,
all our audiences.
thank
And
you.
I'm gonna look this way to see if we have any other questions,
Okay.
on the chat on YouTube, because you're looking at me on
Oh,
Zoom, so that's why you don't see the questions posted
oh
on the
okay.
chat. But I have a second screen here.
Okay.
Um, okay, it seems that uh, oh, one comment that was here that I absolutely love is you want to avoid an acid or acidic environment in your mouth.
Yes.
And it seems that pretty much anything that we put in our mouth, it's acidic if it's not alkaline. And there's only a handful of things that are alkaline that we like on a regular
Sure.
basis, right?
Right. That's true. This is a very good subject that we haven't really talked much about. But yes, it's not necessarily the sugar that is causing cavities. Sugar feeds the bacteria, but it's an acidic environment. So, yes, there are certain foods and drinks that are going to be more acidic. A cup of coffee, a
Mhm.
Coca-Cola, an orange, that's acid and sugar all at once. Um, so, yes. And even the disposable water bottles, pre-filled water bottles, the majority of those, with the exception of Fiji, those actually are very acidic. That water is acidic.
Okay.
So if don't use those. Get yourself a nice glass or aluminum refillable water that you're using your own filtered water at home. So yes, there's that acidity. But your body, every time you eat or drink something, you have something called an acid attack that occurs. It lasts about 20 minutes. So putting something in your mouth to eat or drink, automatically the acid increases. It's part of digestion. This is the beginning of your digestive tract. So it's all attached. This is where it starts. And so you don't want to have little bits of food and drink all day long and graze, because now your 20 minutes of acid attack is happening all day long versus having really purposeful meals several times a day. If you happen to have, your coffee or your Coke with lunch or whatever, your treat is to yourself, have some water too. Swish your mouth out with water, things like that, just to kind of bring that pH back. If you can't brush after lunch, which most people don't, you can still swish with some water, neutralize the pH again, and then it's at a healthier level. So you're not as prone to decay that way. Yeah.
Um, what? Okay, so Marilyn is asking, and I don't know if you're familiar with this. She's asking about a brand called Luminux whitening
Oh,
toothpaste.
Yeah, Lumino, I think it's,
Lumino.
yeah,
And
I know the brand. Yeah.
she's saying these ingredients are clean, don't have peroxide. Any thoughts?
It does not have peroxide. That
That's
was
what
her
she's
concern.
saying. Yeah.
Okay. I
She
mean, that's
thinks
fine.
she's saying peroxide can cause sensitivity.
For some, it could. Again, it's about your own mouth. Just because something's clean and healthy doesn't mean some people react to xylitol. It's a wonderful ingredient. Dentistry's used it for a long time. Same with clove. Clove is used in dentistry too. But some people are sensitive to it. So you know your body best. If you use a product and you are experiencing something different, something irritating, then yeah, pull that out. I've never used that particular brand of toothpaste, but I looked at the ingredients a long time ago. I don't recall there being anything like crazy in there, but I really don't know offhand. It's just not something I use regularly.
Okay. I uh Marilyn, I started personally using the mouthwash. Our mouthwash has peroxide.
Uh-huh.
It has a small amount of peroxide. I use it once a day in the evening before going to bed. I'm not sensitive to peroxide, and it's worked wonders for my
Yeah,
for my gums. But that's completely a personal experience, not saying that it would be the same for someone else. And if someone definitely has sensitivity, then they probably should avoid it.
yeah. And I
That
would
would be
have
the
to
advice.
imagine, you know, you don't want to use straight peroxide all the time, but we use it in
Correct.
dentistry. If you have a little bit of oral surgery, we're going to use some peroxide just to keep the area clean until it heals for the first week or two. Um, but yeah, I wouldn't recommend don't swish your mouth out with peroxide
Yeah,
every day. But if it's
yeah.
inside toothpaste, if it's an ingredient in your mouthwash or your toothpaste, it's not likely to cause, a concern.
She dilutes it with a little water.
Yeah,
That's yeah. That's
perfect. Yeah.
Marilyn is going to be our next guest because she,
Oh,
no, I'm just kidding.
oh, okay. I was like, great.
Marilyn is one of our clients, but I love that she's so knowledgeable and that she's trying different things, and
Yes,
mixing and pulling and taking because that's truly what you do when you own your own health and wellness journey. So,
yes, yes,
congratulations for trying different approaches and in different things and then
yes.
diluting, and seeing what works best for her. I love
Mm,
that's one of the things that I love the most about our Poofy community is that our people take ownership
yeah,
on their own journey in health and wellness and it doesn't let it to, be the responsibility of the doctors and the
correct.
dentist.
Correct. It's about taking in information, trying something new, and realizing, is this doing my body good? And if it's not, then
Well, Leanne, we are going to close our interview for the day. We are so thankful for the time that you have devoted to us. Thank you for all the questions. I have an intruder that just came in my office, my 5-year-old.
ah, yay.
When she's gonna try to rob the cameras away from me.
That's okay.
Oh yeah, Marilyn says I've been buying Poofy since the store was in Rutherford. Thank you so much, Marilyn, for your
Awesome.
loyalty and for trusting Poofy Organics with the care, the personal care and the care of your family.
Yes.
Have a Leanne, we are indebted to you. Thank you so much for everything you shared. We are going to be more mindful of not spitting down the good ingredients down our
Yeah.
drain,
Yeah.
of the type of water that we're drinking, the container that has our water in, the
Mhm.
electrolytes intake, our fruits intake, our diet.
Yes.
And definitely we're going to be more conscious also about how do we rinse our mouth throughout the day, if we
Yeah.
are eating other things or if we're not brushing right after.
Yeah. I mean, it's really about like your body talks to you. in outward ways. So the inflammation, tenderness, glow, things like that. It's not always bad, even though that's what we've been talking about, but your body speaks to you. And it's a matter of just slowing down in life a little bit and paying attention to what your body is telling you and listening and pivoting and making those adjustments until your body truly is happy and you're happy in your own skin. And it's.
And hopefully with your own teeth.
Yes.
Have a good night. Thank you for joining us.
So honored that you asked. Thank you so much for having me. I love talking teeth.